So before we get started, I'm hoping that we could just take a moment and just check in. So if you're game, you just put everything down, sit comfortably. You're also welcome to just observe and not participate. But I thought it'd be a nice way for us to get started today, just to check in, to land here together. So if you want, you can make sure that you feel your feet on the floor, that you're sitting in a relatively comfortable posture. You feel your hands resting on your lap, maybe letting your eyes close. If you want to keep them open, just direct your gaze towards the floor, a couple feet in front of you. So this is just an invitation to check in. So just to acknowledge what's here now. What do you notice that's happening in your mind right now? So what types of thoughts might be bubbling in and out? How are you narrating this moment? So just observing what's happening in the mind. And then perhaps observing how the heart feels and the feelings, emotions that might be here too. Maybe giving them a little name. And observing the quality of your breath. So without trying to change it or make it be something, just see if you can observe how your breath is right now. The sensations of your breath. And then again, going back to noticing how the body is. The shape it's in, the posture your body's in. Just how it feels to be sitting here in this room right now. And then when you're ready, you can just let your eyes gently open up again. You can stretch around if you need to, move around a bit. So I think it's nice to start with just this type of check-in practice. I often start groups that I run this way, some individual sessions that I run this way, just to kind of land here together. I don't know if anyone had any reactions or comments that they wanted to share about that. Okay. So I'm going to talk with you about the clinical work that I do that weaves in mindfulness practices, some really gentle yoga practices with psychotherapy for treating people that are struggling with substance misuse and other issues related to compulsive or addictive behaviors. My background obviously is in clinical psychology. I have my own personal meditation and yoga practice that I've had for many, many years, and I've learned to kind of integrate the two in my clinical work. And now the research is really supporting this more integrative mind-body approach to this type of work. So I want to start by introducing you to this concept of harm reduction. So often when we hear about substance use or issues with addiction, we might have our own assumptions about what that means, right? And this culture has really been infused with what we call this abstinence-only paradigm, right? This very all or nothing, black and white disease model of addiction, which I feel is pretty narrow. And it does not resonate with a lot of people that might be using for a whole host of reasons, a lot of different motivations, and there might actually be some benefit to the fact that they're using a certain substance or engaging in a particular behavior. So harm reduction really is this radical paradigm shift where we take out this abstinence-only mindset, right? It's really about joining people on their path and helping them clarify where they want to go, right? So what relationship ideally would they want to have with a given substance or a certain behavior? And so from there, we can move into empowering people to make changes. And if we think about this disease model, abstinence-only paradigm, it's a model of powerlessness, which I think ultimately takes the individual out of it, and they have to fit into this mold of a traditional 12-step or addiction treatment that does not really resonate with a lot of people that walk through our doors in treatment. Some of you are nodding, so assuming you're with me on this one. But it's not to say that harm reduction isn't also embracing of and welcoming of abstinence, but I think how we get there with our clients is a very different way. It's a way that I think comes from within, and we help people really sit with and understand, why are they using? What gets in the way? How do they experience a craving? What is it like to sit with the craving? Can we then think about the choices that we want to make to respond more skillfully when we're triggered and in the midst of a craving? And so what I find with my clients is that it's a long process. It's not something that we can accomplish over a couple weeks or even a couple months of working together, but it's a journey that we take that might take a couple years to really get to a place of reduced use, of reduced risky behaviors. But I would say that that's a more effective approach because it comes from within. It's really about their plan, their path. And I'm kind of a supporter, I'm a coach along the journey. It's not about me telling them what to do. So one way to think about harm reduction is that it's compassionate pragmatism, which is how Alan Marlatt has described it. Another way to think about harm reduction, it's about meeting people where they're at. So maybe someone wants to come in, they're not sure about what they want to work on, they might be ambivalent, but they know that they want to change something, so we'll welcome them in this exploration of where they want to move. And then the other piece of it is that we don't remove a primary coping mechanism until others are in play. So they might be using a substance to help manage anxiety, stress, to help regulate symptoms related to trauma or PTSD. But without an alternative way to manage oneself, to modulate one's emotions, there's nowhere to go. They're going to continue to use. So part of the work is helping people build other coping mechanisms, other resources to then reduce the reliance on the risky or addictive behaviors. And that's, to me, where mindfulness, yoga might come in as an alternative way to help them heal, to help them recover some of these self-regulation deficits. So the way that I think about substance use, that's complicated. It's a biopsychosocial phenomenon, meaning that there are biological properties, factors at play. We know that there are brain-related changes that do occur. We know that the body is implicated. But we also realize that there are psychological factors, expectations, appraisals, assumptions, belief systems in place around the use, around the substance. And then there are also really complicated social factors, and it's important to realize the context under which a person is using and how they continue to maybe be triggered by the environment, their social circumstances. I really draw from Andrew Tatarski's integrative harm reduction psychotherapy model that looks at the notion of different meanings, functions, what is being expressed through one's use. Is it difficult to express anger, for instance, when one is sober, and then they're able to access those feelings and assert themselves when a substance is on board? And so we might start to tease apart, well, what is that about? How do we begin to express anger in ways that are more adaptive and healthy? And then the self-medication hypothesis, which was developed by Ed Kantsian, really looks at vulnerabilities and these self-regulation deficits that I think a lot of us struggle with, but people that really struggle with substance misuse tend to kind of really, really struggle with these meaning deficits in self-care, the ability to recognize risk and respond appropriately to signal anxiety in the body, the ability to modulate one's emotions, to identify emotions, to respond appropriately to them, and to manage relational conflict, to be more assertive. And finally, issues related to identity, self-esteem, self-worth, self-efficacy. So I'm going through a lot in a very short period of time, so we can definitely pause if there are questions. So I'm also really influenced by the work of Pat Denning and Janie Little, who work out of San Francisco. And another way to think about the biopsychosocial model is this notion of drug setting. And so part of our assessment and our ongoing assessment with our clients is understanding the unique properties of the drug itself or the behavior itself. How are they using it? How does it impact them physiologically, psychologically, socially? What are the set factors? Again, so how are they thinking about their use? What are they trying to cope with by trying to use the substance? And then the setting, so the ritual, the circumstances surrounding the use. And then also acknowledging the fact that if a person is using in a non-familiar setting, they might be more vulnerable to overdose or becoming more intoxicated than they intend to. So that's part of the psychoed that we often do with our clients, is educating them about these factors. And these are just my own observations. I think people come in the door with a lot of shame and stigma, and identifying as an addict, I think, can be problematic for a lot of people and maybe acts as a barrier for them engaging in help seeking. We're in this culture that pressures people to abstain, right? This abstinence-only disease model, kind of AA-based, 12-step-based mindset is terrifying for people. If you've been using a substance for decades, the thought of not having it is frightening. And so why would someone come into treatment if the assumption is I'm going to tell them to get rid of it, or that that is not welcome in my space? And unfortunately, we're still in a society where people are not allowed into treatment if they're not adopting this model. They're told that they have to go somewhere else. They might be discharged or sent to rehab or a detox. And the reality is I work with clients. Many of my clients are still active substance users, and we're working together to help them develop positive change goals and strategies. A lot of the clients that we end up working with also struggle with a history of trauma. They also might be people that tend to dissociate when really faced with conflict or stressors or just overwhelming emotions. Dissociation tends to be a big theme in the clinical work that we do. Just a disconnect in general from one's body, from one's thought processes, one's relational style. So mindfulness in that sense too helps people just become more aware of and familiar with what's going on now. How am I thinking about this? How am I feeling in response to these experiences? A lot of difficulties with self-soothing, self-management, as I've already mentioned. Who will I be without this substance? Who am I? And then going into just really briefly about integrative harm reduction psychotherapy, which is this new paradigm that really embraces the complexity. It welcomes people into this therapeutic space without an agenda, without any preconceived notion about where they ought to be or what's going to be best. And really, it's a co-construction. So we're working together in a really collaborative, compassionate, empowering way with our clients to help them clarify where they want to be in the short term and in the long term, and how the substance might fit in with their lives in any way, if any. And so I'll talk a little bit about what we mean by these terms: urge surfing, ideal use plan, and then how meditation and yoga fits in. So within the integrative harm reduction psychotherapy mindset, we have these 7 therapeutic tasks. And at the heart of this approach is really developing a solid, safe relationship with our clients. And from that safe space, we can then really work together to create meaningful change. We help people develop self-management skills. We embrace the fact that there is a lot of ambivalence, and people might be in different stages of change where they're maybe thinking about changing, but they're not actually ready to take action. And so a lot of people might come in that stage where they know that there's something that's not working, but they're not quite sure where to go. They need a roadmap, and we're there to help them provide the roadmap. We help really set personalized goals, and we develop really specific strategies to reduce risk and increase safety. So this is just one example of an approach that we might use. And so we help people learn how to dialogue with urges and cravings. So initially, a person might not even be aware that they're experiencing a craving or an urge. And so we help them just understand, what does that feel like? And I think all of us can relate to wanting something really bad, right? It could be food, it could be a substance, it could just wanting something, a craving. So we're all humans, we can all relate to that. So it's helping people understand, what are their cravings like? How do they respond to them when they present themselves? And what might be a more effective way to respond to an urge or a craving? And so this comes from Tatarsky's work, where we're dialoguing with the urge. We're asking it, what does it want? What do you really want? Right? It comes in the form of this urge to drink, for instance, but what is that really about? Are you seeking to be soothed? Are you trying to relax? Are you seeking some kind of release in the body? Do you want to numb and disconnect? So how do you understand this craving? What is it telling us that you're feeling this right now? And so the hope is that if we can help people develop these mindfulness capacities, they're able to pause and they're able to sit still with this experience of an urge without rushing into action. It doesn't mean that they can't and that we're not going to then just think about, maybe in the future how to change the strategy. But it's really helping people to shift the nature of the relationship to a craving. The other part of this work is also helping people develop what's called an ideal use plan. So ideally speaking, if we're still going to have this substance in the picture, how do you want to have it in your life in a way that's going to not cause harm, that's going to not be unsafe? So what will that look like? And we get very specific, we might get very behavioral in our plans with our clients. And then we frame it as an experiment. So let's set up this plan, and over the course of the week, let's see how this works out. And initially a goal might just be to track urges, track cravings. And then with time, we might think about how to replace the substance use with a more adaptive response. So one of my clients this past week was really struggling with feeling angry at his partner, feeling resentful, jealous, envious, and that led him to have these really intense urges to drink alcohol. And so we were actually in session and he reported feeling this really strong urge to drink. And so in that moment, we were able to pause together and to think through what would happen if he did follow that urge. What would that look like if he started to drink right now or after our session? How will you feel about yourself? How does that fit with our goals together? How does that fit with this value system that we're developing in terms of self-care, healing the body? And what might you do instead? Can you go out and sit for a couple minutes and just take a couple breaths? Can you practice a meditation that we worked on together? Or can you take your dog and go on a run, play ball, do something else to kind of help this energy move in the body in a different way? So that's a little bit of how we work. We really get in there with people, we get into the nuance of what's going on and then help them think through options. So with mindfulness, I'm really drawn to the works of Jon Kabat-Zinn. I'm interested in mindfulness-based cognitive therapy, and there's this new paradigm called mindfulness-based relapse prevention. So that's where I'm coming from, more from the research world. But this is how I think about mindfulness. So it's paying attention in a particular way, on purpose, in the present moment, and non-judgmentally, which is the classic definition that Kabat-Zinn offers us. And then borrowing from Siegel and colleagues, it's about a stance. It's the stance of welcoming and allowing. It's invitational. So welcoming of what's here now, being able to work with and sit with what's here now. And it encourages opening to the difficult and adopting an attitude of gentleness to all experience. It's a friendly awareness, right? And so often people say, oh, cravings are bad. I don't want to feel this. I need to get rid of it. I'm in a battle with my cravings. And so we try to disarm that and to really think about cravings as including important data, as being messengers, as having information that requires our attention. So it's not something that's bad or a signal that treatment's not working. It's something to really pay attention to. And I think we also can relate to this notion of mindlessness, right? Or being on autopilot, just running down the street, not even paying attention to where we are, what we're doing, maybe looking at a phone or just being totally distracted. And so we often talk about slowing down. Where are you? Looking around, using your senses. The difference between walking and walking mindfully, walking with this intention to be present and aware. And so for me, mindfulness has these components of like a structured practice, a daily practice, but then mindfulness that's weaved in throughout the course of the day. So that check-in practice that we started with is something that I do myself throughout the day. Just kind of, where am I? How am I? What's playing through my mind? How's my body? What emotions do I notice? And so that is something I'll teach my clients to do, throughout the day, building in these pauses to check in, to notice what's here. And with time, we're in this autopilot phase less and less. All right. I'm also really drawn to Martine Batchelor's work. I don't know if she's someone that you're familiar with, but she talks about these 3 factors in mindfulness of concentration, inquiry, and acceptance. So just the foundation is learning how to concentrate, how to pay attention, and how to move the object of awareness. And for some people, that might be really challenging. We might have to start with focusing outward on external experiences and senses before we can move inward into breath and the body. And especially if somebody has a history of trauma, we need to be really careful about moving into the body too quickly. And so I think that becomes part of the assessment, part of how we negotiate the treatment with our clients. And we might need to focus on listening to sounds in the room, taking in what we see with our eyes, taste, sense first, and learning how to be aware of and attentive to those things before noticing how it feels to be breathing certain sensations in the body. And then from there, we can have this dialogue, this inquiry of, well, what's here? What's needed in this moment, right? And that's how we work with cravings. What is this craving about? What is it telling me? What is this in response to? How do I want to respond skillfully to this craving? And then being able to rest in this sense of natural awareness or acceptance of what is, right? And that's where the freedom is, being flexible, being open. So this just summarizes it again. So paying attention in the present moment, non-judgmentally. Just in the interest of time, I might keep going. And then here's a visual of something that I might explain to clients, right? So we have our direct experiences, and then we have these layers and layers of reactivity, and I call it chatter, you could call it noise, thinking, constructing our experiences. And for a lot of us, that's where suffering is, that we construct a story about our experiences that is distressing, that might be very self-punitive and self-blaming and shameful. And so it's how to start to first just bring awareness to that, to notice that that's the pattern, to notice how that might then relate to urges or substance-using behaviors, and then how to slow down with that and pay attention, and then move in different directions, and maybe learn how to shift that chatter, that noise, how we're constructing our experiences. So if we were to put it all together, for me this is about learning how to pay attention, how to slow down, how to think about options, how to respond based on what's really needed. And so we know that mindfulness has been shown to improve distress tolerance. It helps us be more accepting of, and I think more flexible in the moment. It helps us be more aware of what's happening in the body, slows down our heart rate, helps reduce the autonomic nervous system response, helps activate the parasympathetic nervous system's response, which is the relaxation response. I would say has benefits in the immune system. And it also just helps us, I think, have more choice in how we respond. So I feel like I've already been saying this, so I'm going to keep going. So this is an example. I'm just giving you some examples of specific strategies that I might use in my clinical work or my work with groups, starting with just working with breath. How is your breath now? We could even just take a moment right now. You could take a breath in, and exhale, and just observe your own sensations of your breath. Right? Just noticing where you feel your breath the most, starting there. For some people, it's difficult to focus, and they might need something to kind of capture their awareness. So that's where maybe counting the breath comes in, observing how long it takes to inhale, how long it takes to exhale. And this is all kind of done collaboratively with the spirit of curiosity, of openness with our clients. Just starting to learn how to feel the breath from the inside out. And I think of the breath really as the anchor to the moment. And so one practice that I often use with clients is this 3-minute breathing space, which is just another awareness practice of, again, what's here now? What are you noticing? How is your breath? How are you feeling in your body, in this space, in this moment? And then working with feelings. So again, this comes from Martine Batchelor's work, working with feeling tones, being really curious about feelings, how we relate to feelings, how they present themselves in the body, our reactions to them. There might be layers and layers of different feelings. So anger might be what's on the surface, but if we peel that and look at what's underneath it, maybe there's hurt, maybe there's guilt, shame, pain, sadness. And so it's just starting to become familiar with what's there in a way that's open, that's kind. And my background is in cognitive behavioral therapy, so this is pretty seamless for me to think about working with thoughts and helping people notice the relationship to thoughts, to maybe problematic behaviors, and how to maybe develop a different relationship to thinking. That thoughts are not facts, thoughts are not permanent. And some people find it helpful to develop what are called self-soothing statements when they're really stuck in these like ruminations and these like self-critical thought loops. May I be at ease, remembering to slow down. Thoughts are not facts. And then the sober breathing space is an iteration of the 3-minute breathing space where we really work with people around an urge or a craving. So if someone notices that they're in the midst of an urge or a craving, they might practice one of these meditations. So the sober is something that we do teach a lot of our clients, of just stopping and slowing down, observing what's happening, what's here, taking a couple of deep breaths, focusing the attention just on the breath, expanding your awareness, again, to include the body as a whole. And then also remembering the intention. How do I want to be? What do I value? How do I want to take care of my body? And then responding mindfully versus reacting and being more reactive. With urge surfing, it's teaching people how to use the image of a surfboard and imagining that the craving is like a wave. And so we kind of think of the breath as like a metaphorical surfboard to help us navigate and negotiate riding out the intensity of a craving. And so with some clients, we'll do this kind of guided practice with them. And when they're in the midst of a craving, they might choose to practice something like that. And so with yoga, and this I'll do with some clients already come in to see us with knowledge of yoga. They might already have a yoga practice, or some are totally new to it. And I do it very gently. It's done maybe in a chair, or sometimes we'll lay on the floor together. It's done right in the psychotherapy room or in the context of group therapy. And you know, there's some misconceptions about what yoga is, that it's a religion, that it's only for flexible people. But I think of it as meditation in motion. And for some, that is the way in which they begin to meditate, is by doing yoga. And for me, certainly personally, meditation for me came about through my yoga practice. And that's really how I learned to be inside my body, was through my yoga practice. So that's what I try to impart with my clients. So some of the benefits, there's a book called Yoga as Medicine that I think is a nice resource. Again, it helps develop these self-regulation capacities, these self-soothing capacities. Again, not unlike mindfulness, helps us slow down this chain of reactions. Learning how to breathe in postures. Right, so imagining the breath as this balloon, so thinking about breathing as being 3-dimensional. And I've done twists and folds with clients, and just to help them see how it feels to breathe in these different postures, to move the body in different ways, and just to be playful and to observe how breath is in these different postures. And so there's this whole new world now of trauma-sensitive yoga that's coming up. And a lot of research is being done in Boston with Bessel van der Kolk's research team. And so they're finding a lot of efficacy and a lot of benefits to teaching trauma survivors how to practice yoga in these very safe and very skillful ways. So it's teaching people how to take effective action, to slow down and listen to their bodies, to learn how to create rhythm and kind of be back in sync with the body and the breath. So I've got maybe just another minute or so, I think. So I'm going to put my contact information up. And these are some websites that I think are really helpful. And so here's my contact info. So on my website, which is jennifertalley.com, I have meditations that I've recorded. If you click on the practice tab, if you want to listen to what it sounds like, happy to share that with you. I know we probably have a minute or so, but I don't know if there's a question. Yeah, if anybody wants to ask anything.
I know that this theory is very resonant with people who feel that like the AA model is way too rigid. Are there some people problem with like the kind of laying out the sort of strategy of like how often, how much, stuff like that? Like, are some people really resistant to that?
That hasn't been my experience because we really do view it as a partnership. So the treatment is done in collaboration with our clients. It's really us negotiating where they want to move and us supporting them in that direction. Yeah. Yeah, and if there's ambivalence about change, then we'll address the ambivalence, right? The part that wants to continue using with the part that doesn't want to continue using, that conflict that might exist. And just being open to exploring that. Yeah. Any other questions? Did everything I say make sense? Mm-hmm.
Thank you.
Is this available online by any chance, this presentation?
We can make it available. Yeah.
You had to go through it quickly, but it was very informative.
Mm-hmm. Sure. I can maybe throw it up on my website if Jeff can't get it out to people.
That'd be awesome.
Yeah. We periodically host day-long workshops on mindfulness and working with cravings. So happy to share that info too. All right, so should I wrap up? Are there any other questions or comments for me? Oh, okay. So I work at the, oh, did you have a question? Oh, you can ask.
No, it's kind of open-ended. I wonder what your thoughts about DBT as that you were talking about.
I think DBT is great. I think for some people, if they're doing true DBT, the format can be a little rigid at times. You know, to do true DBT, it's a pretty intensive program. So I incorporate elements of DBT skills, I think can be tremendously helpful for people.
Sorry, what's DBT?
Dialectical behavior therapy, developed by Marsha Linehan. And you know, the crux of her model is mindfulness, interpersonal effectiveness skills, emotion management skills, and distress tolerance skills. So it really does fit with this model that we're describing, but her protocol can be, you know, it's a big intensive program to actually do like full DBT.
Yeah, I like how you said elements. I enjoyed your presentation.
Thanks. Any other questions? All right, well, thank you, everybody.